What's up, family, and welcome to Show and Tell Boston, where we facilitate tough and fun conversations nobody wants to have. My name is Cricket Smith, and I have my co-host Tata to the left of me. Tata, say what's up.
What's up?
We are excited to officially kick off our community health workshop series with the team of Massachusetts CEAL. And the episode that you're watching today is designed to address the health disparities within Black, Brown, and BIPOC communities. Our goal is to provide resources, tools, insight, and education in order to diminish these barriers and create equitable health access to everyone. Today's topic of conversation is COVID and long COVID. Joining me here today from the BMC team and the Mass CEAL team is Jasmine, Dr. Zai,
hello,
Shaquera, and Miss Annette.
hi.
How are you ladies doing today?
Okay.
Word. All right, so let's first start out with you ladies introducing yourself, your roles at BMC and or Mass CEAL, and why you feel like addressing these disparities is important. Jasmine, you could go first, baby.
Okay. Hi, everyone. My name is Jasmine Granadeño, and I am a community engagement specialist. And my role with MA CEAL is connecting resources with the community, but also connecting with community organizations around Massachusetts, not just in Boston, and connecting them with the resources they need to address those health inequities that we see and addressing those barriers. And so that's also my goal. It aligns a lot with my passions in alleviating those barriers any way we can. And so that's a little bit of what I do. So,
Thank you.
Thank you.
Dr. Zai.
Thank you, Cricket.
You're welcome.
My name is Zai Marathe. I'm an infectious disease physician at Boston Medical Center. And throughout the pandemic, my role has been to set up and lead all of the outpatient COVID-19 programs, including the long COVID clinic at Boston Medical Center. At the beginning of the pandemic, there was funding provided federally for establishment of Community Engagement Alliance to address some of the health disparities that are noted or that came to the forefront because of COVID-19. Like, it was becoming more visible, it was becoming more recognized. And that holds true for the type of patients that I see in the long COVID clinic, because they don't represent my community, like this community that I work for. And that's how I got involved with MA CEAL, to address those disparities, understand what the barriers are, and provide education so that we can have a more like a give and take instead of us just telling the community without actually listening to them.
Thank you for what you do.
Thank you.
For real. Miss Robinson.
Hi, everyone. My name is Shaquera Robinson. I am also a community engagement specialist here at MA CEAL. And just for the folks who are watching us for the first time, MA CEAL stands for the Massachusetts Community Engagement Alliance. And Annette will share more about how we got started. But I come into this role passionate about helping to disrupt the cycle of health disparities in Black and Brown communities. Also, too, as someone who loves and has a passion for education, being a community engagement specialist allows us to go into communities, to be the boots on the ground, get connected to those who are in the community, whether it's community members or community leaders, to make sure that we're disseminating accurate information and we're extending the welcome to link arms to make sure that we're addressing this issue effectively.
Thank you, Ms. Robinson. And Miss Annette.
Hi, my name is Annette Nasabuga, and I am part of the MSCEAL team. I am the program manager, and I do oversee the program. And to tell you a little more about MSCEAL, Massachusetts Community Engagement Alliance, we started in 2020, and the NIH, which stands for the National Institutes of Health, is our funder. And the reason why they trusted us and decided to fund us is because of the work that is needed to be done in the communities to in the communities regarding the COVID-19 pandemic and long COVID. So then in 2020, we're now in 2024. Our mission has changed a little bit, and where we realized, or they realized, that there's a lot of impact in the communities regarding the chronic diseases. So that's where we're moving in. Yeah, to tackle things like diabetes, hypertension, maternal health, and many other illnesses.
Thank you for that. Can we start off with the definition of what a health disparity is? Because I'm thinking like, health disparities. If I didn't know you ladies, I wouldn't even know what that word is. So can we start off by defining that term?
Public health.
And that's reminding me about public health.
Yes.
So,
Yes.
In a layman's term, a health disparity is anything that interrupts one's overall health, whether it be physical, mental, emotional, where it disrupts their ability to live a whole life and free from disease or infirmity. So that's what it is in a nutshell, right? And so when we talk about addressing public health disparities, we're talking about making sure that folks understand what has happened to them internally health-wise, but then also what is happening to them in their community, because what we know is the communities that we live in have a greater effect on our overall health outcomes. And so we can't address health disparities without addressing the overall issue. And for some of us, the passion is getting to the root causes of some of these issues.
Can I? Oh, were you going to say something? Can I ask, what were the disparities that actually, we all know what happened in 2020, but, what was it that really caused the MACL to come together, to be funded, what did they see that, like, okay, this group needs to exist?
Yeah, truly, that's a great question. So if you looked at who was affected the most because of the pandemic when COVID-19 first started in the communities and disrupting our life, right? It was the frontline workers who are primarily from the BIPOC communities, people who come from housing developments, from overcrowded situations, people who have poorer access to doctors and to healthcare systems. And they were not just being infected, but their death rate and hospitalization rates were much greater, 3-5 times higher than people who lived in affluent communities who predominantly belonged to like the white educated communities and were more likely to seek early medical care. And because of that, you really could see that COVID-19 created these two distinct groups, socioeconomically disadvantaged, and then the more affluent groups, where the socioeconomically disadvantaged group bore the brunt of the worst outcomes of COVID-19. And we wanted to address that because our goal is to promote health for everybody, regardless of their background. And the federal government recognized that. National Institutes of Health, CDC, like you talk to anybody, our mission became one. And so that's what drove the development of the SEAL teams. So Massachusetts CEAL is just one of many, but we are the only one in Massachusetts. And then there are others in other states.
That's a great explanation. Thank you.
And what exactly did the MACL do, like actionable things? Was it just spreading knowledge, or what were you doing to help like address the disparities like with the organization?
So I can speak from a clinical perspective, and then I'll give it over to your community members to actually understand what happened as boots on the ground, right? So what we recognized early on was there was a lot of vaccine hesitancy, for example. So when vaccines started being rolled out, people were not confident. People felt that it was too soon. Like, how did you already come up with a vaccine? But the reality is that these technologies have been in development for 20 plus years. And providing an impetus and accelerating the process through government funding actually enables us to develop vaccines in a much more rapid manner. And today more so than even 20, 30 years ago, right? But getting that word out in a way that was palatable and understandable by community members was a monumental task. Because as a physician, when I'm talking, even now, I recognize that some of the words are not familiar to my community members. And so having those boots on the ground where you can relate, like you identify with each other, you have similar challenges, and you recognize what the barriers are. Because sometimes as healthcare workers, we don't understand it. Because I'm like, yeah, vaccine is a no-brainer. Why would you say no, right? But actually understanding why people might feel differently is also an important task. So one of the first things that MACL did was to address this distrust or mistrust of vaccines and then roll out robust vaccination programs, like basically putting your money where your mouth is, right? Like making it count and saying that, yes, we are here for the community and this is our mission. But then the actual work was done by these lovely people. So I'll have them speak more to it.
So I don't want to take any credit for what happened in 2020 when COVID first hit the community, because I was not a part of the MACL team. What I took from all that you said, Dr. Zai, was literally this was a collective responsibility. And so if I may, I have to say that shout out to Gloria Ruiz, Jessica Ortiz, Patrina Martin and her team. So we are funded by the NIH, but we sit at Boston Medical Center. And so Boston Medical Center partnered with MACL to be the boots on the ground to make sure that folks in the community were getting to the hospitals, getting the vaccinations and knowing what this disease was in the first place, and then making sure the project called the Long COVID Ambassador Training. And so what we did is Zai and some other doctors put together this huge curriculum around the COVID and long COVID impacts in BIPOC communities. And so myself and Jasmine and some other team members, we were trained as master trainers with all this material and education. And then in turn, we had to go out and train community members to become ambassadors so that we can disseminate this information into different communities so that we can make sure it's getting to the places where it needed to go. And so we don't take full credit. This is a collective responsibility. And although many have think that, COVID is waning, it's gone, it is still active. And so you're going to still continue to hear Dr. Zai and many of us talk about the impacts of COVID-19 and how to continue to protect ourselves. But the reality of it is this a collective responsibility?
And Ms. Annette, how does that directly relate to your role as program director, especially on a day-to-day?
Well, on a day-to-day basis, like I mentioned earlier, I do oversee the program. For example, if we do have events to go to, like community events to go to, I work with the team to make sure we do go there, we present ourselves, and we talk to people about things that matter to them. COVID, long COVID, all the other illnesses, and we are the listening ear there. And by doing that, we are building trust in the community. They do trust the information we give them because there was a lot of mistrust during the COVID times. So we are the center of this.
Guilty. I was the one of those that was mistrusting.
Don't tell.
Yeah, 100%. Dr. Zai, can you tell us the difference between COVID and long COVID? What the heck is a long COVID?
Yeah, I don't know that either.
What's a long COVID, lady?
So COVID-19 is the name given to the disease that was caused by SARS-CoV-2, which is a virus, right? So the acute disease, so the runny nose, fever, chills, the upper respiratory symptoms you get with a viral infection.
Yes, ma'am.
That's what COVID-19 is. Unfortunately, at the beginning of the pandemic, a lot of people were way, way sicker because common colds shouldn't be causing that, right? But this virus was special. It changed something where you got like rip-roaring pneumonia in both lungs. People ended up in the ICU on breathing machines. Some people didn't make it out of the ICU.
Come on.
Yeah.
And those who survived were left feeling guilty because they lost a lot of family members. Even amongst the survivors, slowly but surely, people recognized that it was taking them a really, really long time to go back to their baseline health. And again, other viruses cause it, but SARS-CoV-2 was special because it affected thousands and thousands of individuals. And many people, I still have some people in my clinic who've been struggling with not attaining full health since 2020. And so these sequelae, or the outcomes that lingered after COVID-19, is what we call long COVID. And it's actually a community member who came up with the term. So there was this archaeologist in London who was struggling to get healthy after having had COVID-19 back in 2020. And so on Twitter, she tweeted, #long COVID, I'm still suffering, right? And a number of people responded because it resonated with everybody who was still struggling. And from then on, that's how the medical community got to know about it, and then the research community. So this is a new diagnosis. The term is patient coined because the actual scientific term or clinically correct term would be post-COVID syndrome or post-acute sequelae of COVID-19, which is a mouthful, right?
That hurt my brain listening to that.
I'm sure it makes my brain hurt too. So long COVID is a much more easier term to use, and it actually captures the essence of what people experience without having had that full recovery.
What are some of those experiences or symptoms of long COVID, would you say?
Oh gosh, there's over 200 symptoms.
Okay. I don't know if we have time for all that.
Yeah, I know. So, the most common symptoms are probably memory fog, excessive fatigue. Even the slightest exertion leads to crash and burn. So think about all those people who talk about chronic fatigue syndrome. This is that. Like, it mimics the symptoms of chronic fatigue. Additionally, in different people, long COVID looks different. In some people, it can cause a lot of heart palpitations, shortness of breath. People who have lost their sense of smell and taste may not regain it. Others have like rashes, joint aches and pains, muscle aches and pains. So it looks different for different people. And like I said, it's over 200 symptoms.
For those people who like lost sense and taste, it's like we don't know if that's coming back, or there's no for that. It's just kind of we'll see what happens.
Well, the good news is that I do have people who recover 100%. And I have people who are on this journey to recovery. Like, they may not have recovered 100%, but they're getting there. And then, like with any other spectrum, unfortunately, I do have people who haven't experienced recovery. When it comes specifically to the loss of smell and taste, I have people who've regained it 100%. And there are some things that we train people to do, like using like a smell kit, so that you learn to smell cloves or jasmine or orange, like the citrus smell, so that you train your nose and your sense of smell to be able to recognize that. And sometimes it works.
Yeah. And I know MassSEAL is like moving on to different things, but can you guys explain like why talking about COVID, long COVID, since 2020 is still important, and why that subject like matters? Like,
This is for anybody. Anyone can answer this question.
Yeah, I might actually have Annette and Shaquera answer it, and then I can chime in.
Because we thought it was over. We're actually really shocked to see that we should still be, taking precautions, even though, we're still able to go back to work without having the vaccine.
Masks
and
all
we're
that.
not. It's not as stressful as it was in the beginning, especially with the 6 feet apart, people wearing their mask, people kind of really afraid to exist, you know?
Right. From the little experience I have, COVID is still around. It's still lingering around. Only that now probably it's buried into flu. You know, some people might think they have flu, maybe then, but it could be COVID or long COVID. So it's still around. And also, when we go to the communities, they yearn for that information. Many people have not heard about long COVID. They don't know that it even exists, but they do have the symptoms. So we would not do this work if people are not, they're not interested or need this information. But it is still around, big time.
If people are still like experiencing those symptoms, like, how would you even know to even ask if this, like, how, like, you go to your doctor, you explain certain symptoms that you have. Even I have a recent experience of going to my doctor, and she kind of made excuses on my behalf, kind of blaming things on me, you know, being a mom, being a new mom, being a mom of 2, me having 2 kids under the age of 4. And it's like, listen to what I'm telling you first. Like, let me get it out, and then you could create your own diagnosis based off of your personal experience or based off of your professional experience. But don't speak for me. So even like as it relates to vaccines, how could you create a sense of trust between the people who kind of want a vaccine and are afraid to get it, opposed to the people that are just like, I don't want it because I'm afraid?
I think from a community engagement perspective, trying to build trust around vaccines, first we want to know what the resistance is, right? What the hesitancy is, where that comes from, understand the root cause for that.
Right.
We know the general historical causes, right? But for some people, there are new perspectives and reasons why they are opposing to vaccines.
Yeah.
And so once we know what that is, then we could approach it in that manner. I think if we try to do this cookie cutter, broad, one approach is for all, we're going to lose a lot of people because we have to tailor what people know and what people don't know and consider those factors. Right? Because the reality of it is people cannot make informed decisions without the right information. So that's why we're making sure that we're being, accurate. We're building these meaningful relationships. We're helping other community members and community partners to build the trust in terms of, we have the curriculum, we have the information, we have the knowledge. We want you to link arms, learn what we learn, what we know. We're going to learn what you don't know and how we can make these things coexist and really try to leverage off of that. From our role as a community engagement specialist, we're not trying to tell people how to do their job. What we're doing is we're finding the community leaders who are already active in their communities and harnessing their power. Because we can go anywhere and try to push this education and this information, but we need to get to the people who already have these built and entrusted relationships. And that's a huge part of what we do.
It's amazing.
Can I get into the hesitancies? Because we do have some people that told us what their hesitancies were or why they were resisting. Can I just ask you guys first, like, what have you guys come across in people being hesitant about vaccines? What's like the main ones, top maybe 10, top 5, top 3, like reasons why people are...
So, I think the main thing we heard was it was too soon. How did you develop the vaccine so soon? We heard that they had genomic material, microchips, tracking chips, things that the government should not be putting in there. We also heard that vaccines were being pushed to BIPOC communities without actually having a shared decision making with them. Like, instead of it being a give and take, the healthcare workers were going in and almost trying to force it to the community members to accept this as a way for protection, right?
You kind of seem like that, not gonna lie.
Yeah. and the general distrust that exists within BIPOC communities from their own experience or from having heard it from others, which is very true, right? And that all factors into how you perceive healthcare workers going out and telling you to do something you may not have enough information about. And so that was the major pushback. And it still continues. Well, now it's changed a little bit. It's like my patients come to me and say, you ask me to get the COVID vaccine every 6 months. Why should I? Right?
Yeah.
So there's like a lot of COVID burnout. But I personally think knowledge is power. And talking and understanding where people are coming from is critical to build that trust and to together achieve public health. Because ultimately that's our goal, right?
So when people are skeptical about the amount of time it took for the vaccine to come out, is there like historically any other vaccine that came out around the same time, like around that same time sequence? What would you say to someone skeptical about that situation?
So you mean new vaccines that were released around the same time as the COVID-19 vaccines?
Essentially about how fast it came out. Is there like other vaccines that came out within essentially like, what was it, like maybe the year of like a pandemic or some sort of
6 months?
Like within 6-7 months? Well, COVID-19 vaccine is certainly the first one because it was on an accelerated path, right? But now that we know how to make that technology work, there's others. So like we repurposed the Mpox vaccine, which was developed for smallpox, for example.
Yeah.
So smallpox no longer exists in any of our communities. And so that vaccine was repurposed for Mpox and trying to show that it's effective in preventing Mpox. Mpox is a new term for people in the community. It was referred to as monkeypox, and so people may be more aware of that. But then the name was changed to just Mpox. So that's another vaccine. And then using similar accelerated development, others like the flu vaccines are in development using similar technology because every year, like if you go to your doctor every year, you're getting a flu shot, right? Because flu changes how it looks like. And so for years now, the vaccine committee meets in the spring and decides what vaccine is to be made for fall flu season. And they make it in 6 months.
Somebody lying. Somebody lying. Somebody lying.
What was the vaccine that nobody trusted? It was from the people that make the baby stuff. Was it Johnson?
The Johnson & Johnson.
What was the complications with that? Why did people not trust that? I feel like they had a lot of pushback.
I'm not sure that that's the only vaccine that had a pushback.
Come on now.
But the J&J vaccine was a single-dose vaccine. And the ones that were 2 doses, the Pfizer and Moderna ones, which were most commonly used in the US. There's others from AstraZeneca and so on, because there's lots of different vaccines approved at this time. But those had just better protection effect and also how quickly they were rolled out. So I think the uptake for those was much higher.
This is very interesting.
Actually, you should just come on.
Shaquera, from a community standpoint, how would you respond to people who skeptically view how people saw how quickly the vaccine was made?
Again, that knowledge is power, right? Learning what you don't know and not being afraid to ask questions. And then also, too, looking at the historical context of vaccinations, looking at the reality of people who are unvaccinated versus those who are vaccinated, and what those outcomes are. Because we can have this social construct around, it's unsafe, they're putting something on us, they're trying to kill us off. We can have that, and to an extent, it's true. But at the same time, you need to look at yourself and look at your health and what it would mean to you to be vaccinated or unvaccinated, and how is that prolonging or giving you an extension towards a healthy outcome, right? And so I think when we talk about vaccinations in any space, whether we're talking to underserved communities or communities who have, quicker access to vaccinations of any sort, I think the reality boils down to what do you know and where is this decision coming from? Because for many BIPOC individuals, we learn about health and health aspects from our cultural, perspectives. And so sometimes we're taught that it's safe and it's not safe. And then the other piece is lifestyle. Did you grow up going to the doctor and getting your vaccines every year and going to the dentist? And those are disparities that are very distinct across different family dynamics. And so I think when you have a built-in understanding of what health is and how important it is to your everyday, I think you look at life from a different perspective. And for holistic approaches, I think that's a different conversation.
100%.
So I would digress to say that knowledge is power, and people who are on the cusp of whether or not they believe in the outcomes of vaccines or not, I think they should contact us and other spaces that can give them that information and education. Because even some folks who took our LCAT, the long COVID ambassador training, we had a lot of people come in and say, oh, absolutely not, no vaccines for me.
Yeah.
And they were crying during our sessions because they're learning about the impacts of COVID, and they're seeing the results of the distinct differences between the folks who were not vaccinated and folks who were vaccinated. Specifically to COVID, the folks who were vaccinated, they didn't get as sick as the folks who were not vaccinated. And so some people were able to, go through obviously the ramifications of having the disease, but they had a better outcome, meaning they were able to survive it. For some people who have a weakened immune system, we got to have this conversation about why you do not trust vaccines, because potentially this could help save your life.
Yeah.
And so for me, I always think about that CPR card. You take a CPR course, but you don't ever know if you're going to need it. I think people need to put their mindset into that same thing, but also too, think about the people who are expecting you to arrive or leaning on your care, right? And so if you're a mom, are you getting vaccinated to make sure your children are healthy? Are your children vaccinated to make sure that when they're around other children who may not be vaccinated, they can have some sort of a healthy lifestyle? So I think it's learning what you don't know. And being okay with that. Learning from new perspectives is okay.
And Annette, from a community program perspective, were you guys able, or how were you guys able to address the skepticism, and were there any tools or resources put in place to address that skepticism? Did y'all have a webinar? Did y'all have a PowerPoint? Did y'all say, hey, we ain't got no tools and resources for y'all. Get out of here. Get out of here.
Right. I don't want to say this, that I was not part of the program then.
Okay.
But our team went into the communities. They educated people. I'm sure they had a lot of Zoom sessions as well as in person as well. And together they teamed up with the BMC community engagement team and other teams around BMC, and they did a lot of education and talking to people about COVID and what they should do and what they should not do. Yeah, so.
That makes sense.
Can I actually add?
And I'll add after you.
I mean, I am very proud to work at Boston Medical Center, in case it's not apparent, and I'm very proud to be part of MA SEAL. And actually, at the beginning when vaccines were being rolled out, like we as physicians were taught how to talk to patients about vaccines, about addressing vaccine hesitancy, and what to expect. Like, what is the patient perspective when you're trying to tell them? Because as a clinician, you have to recognize that your doctor has 20, maximum 30 minutes to see you from head to toe.
Come on.
Yeah.
Right?
That's so true.
And so as a patient, you're already feeling rushed.
Yes.
Yeah.
And then on top of that, your doctor's telling you to get a vaccine
Feel
that
like a
you're
salesman.
not comfortable
Yes.
with.
Yeah.
Yes.
And so we were taught by the leaders at BMC to slow down, to take the time to understand the patients, and we were taught how to have this conversation, which, I mean, I'm infectious disease specialist. You think I would know, but I found it incredibly helpful for myself. So I
Thank
think
you
that
for
was
sharing
unique
that.
and that was
Yeah.
great.
Yeah. Thank you so much.
And they taught staff as well.
Okay.
Yeah, I was one of those staff members that had a lot of questions, and that why now? Why are we being rushed to get the vaccine? How was it developed within a short time? So I asked a lot. Was there research being done on BIPOC communities? How many people participated in the research? Still, I'm also proud to be part of BMC. They organized leaders and clinicians and some of the people that took part in different research projects who look like me. So I was very comfortable asking them questions that they answered, and then I was able to pass on part of that information to people who look like me in the community.
Thank you.
I'm not gonna lie. So I'm probably like the person you guys would be speaking to, because I know that I didn't get vaccinated. I was still working during 2020. I was the one guy on the MBTA, just going to my job, going back and forth to my job. My whole family caught it maybe like 3 times, but I don't know if I never really got sick. So I'm not really a conspiracy theorist. I wasn't like trying to avoid microchips. But I was like, I don't know, maybe natural immunity. Like, I was like, oh, maybe it's just natural immunity. Like, I think you just come and goes maybe. But what do you say to people who are kind of like me, who are just like, no, just like natural immunity is cool. I feel like I'm young and healthy and I don't really need to get a shot.
So I'm going to take this opportunity to also introduce myself.
Yes,
Hi, everyone. Darren Lita, she, her, aya pronouns. I'm a community activist first, but I also work with health centers in Massachusetts, specifically in substance use, but I do have experience as a community health worker and working for the state. None of my comments are related to my place of work, just to say that.
Nice.
But I will say that part of what is lacking, institutionally so and systemically so, is actually listening to the patients and prioritizing community engagement in practices in medicine, right? So we just have to, we have to put it in context when we're arriving in 2024, that in the beginning of this whole infrastructure of medicine and health, it did not include people like that look like either of us, right? It included white heterosexual men who were slave owners and were also genociders of our native and tribal communities. So we have to remember that the system was never really made to help us, right? And so when we fast forward to 2024 and we hear from, myself included, right, or providers or people that were trained to come into the community to talk about COVID and long COVID and substance use disorder and maternal and child health and HIV and all these different things, we are naturally going to be skeptical.
Come on.
Like, that's a natural thing that's going to happen. Exactly. It's literally in our DNA, passed down from intergenerational trauma, right? So because that's not taught really in medical school, right? This whole, why does the community not trust us? That's also their natural response. So I also give folks grace, right? When it comes to folks trying to be like, I don't understand what's happening. Right. You don't understand what's happening because they didn't teach you that, right? So now, thankfully, because of years and years, decades and decades of advocacy of folks that look like us and well-meaning white folks, to actually incorporate things like that, right? So when you're saying that story, back in the day, they wouldn't even have heard you out, right? Because it's like the supremacy of like, I'm a doctor, I know what's happening, I know what's best. Listen to me, and if you don't, then you're a bad patient, right? And that's a common thing that happens in every sector. Oh, you're a bad, person that you don't want to engage in this activity, right? Putting it on the individual, which is also it's also racism, right? It's also classism, right? It's also all those different things. So how do we do that? by having people like us and well-meaning folks to say we need to change. We need to evolve. We need to improve the systems that we've inherited. That comes from the backs of our native and tribal folks and our enslaved folks. Because remember that a lot of the medicine and all of the treatments and a lot of the tools that we had were used without anesthesia, specifically on our native and tribal communities and our black and brown familial and societal ancestors, right? And so when you come to me and say, hey, I think I have heard, I have, what's the word that you said? Immunity?
Natural immunity.
Natural immunity. Because I'm on the train, I don't even use a mask, and I don't have it. As a person who has training in this, can be like, heard you. What type of things are you doing at home? Do you do anything natural that your grandmother taught you a long time ago, like putting, onions under your feet and put the socks on? Do you take vitamins every day? Like, are you taking a tea every morning with honey and ginger and all those things? Oh, that actually probably is helping you because that improves your immune system, which is exactly what the COVID with COVID affects, right? Attaches to. Yes. So that actually makes sense. But if you can give me a moment and consider what I'm going to say to you in the next sentence about what a COVID vaccine is. So a COVID vaccine is right. I'm not dismissing what you're saying, right? We're working together as a community to decide what the best course of action for you is, right? And that's how it wasn't in the beginning, right? It wasn't like that. And so the question that you had mentioned earlier about the J&J vaccine, people didn't, it's very complicated because you had the 2 doses, Moderna and Pfizer. The J&J vaccine, which remember, there is historical context with Johnson & Johnson. Remember, this is the brand that also has the baby lotion and the baby oil that over years has been shown to affect negatively the black and brown community because that's the cheapest options that we usually had. It's connected to, of different variables of cancer and all these different things. So it already had a natural hesitancy for the community. And so now you're telling us that that's the better one for us without any explanation. A lot of the explanation of that was because of the lack of trust and all these different reasons why black and brown folks are not getting it. We're just going to suggest this one as first because they most likely won't come back, without explaining why folks won't come back, right? It was more of like, oh, it's expected, versus like, you're already disrespecting me by saying that. Right there, that's already a disrespect. How do you know that I don't have time to come back? So that's already, again, another lack of trust. You broke trust there. And every step of the way, you have to make it intentional on your end to not break that trust. So you would say, hey, because of historical context, you already trusted me the first time to come, so why won't I have you take this vaccine so that you don't have to come again and put yourself in another vulnerable position, being in front of a person that you already lack trust with, and just have a one for all, right? Because all of them worked, right? You know what I mean? And so you just have to approach it differently, and that's just not what the priority was in the beginning. And that's why we have programs like MACL.
That was a lot of important information. A lot of the things that I know that the community wants to hear, a lot of addressing skepticism, a lot of answering a lot of questions. But I think that even from my own personal experience, the fact that it was so quickly put out and, even reading the effects that it has on the body, and not really addressing, like, yes, it's okay to get the vaccine, but like, let's talk about our immune system. Like, why aren't we talking about improving our immune system is what I think, especially like the holistic. We have a lot of artists within our community. They try and drink, like you said, they try and drink some tea and call it a day. Drink that Haitian remedy and call it a day. But because the COVID-19 and the long COVID affects your immune system and can affect your central nervous system in such a way that people aren't really used to realizing, because a flu is different from like something allergy. When your immune system really reacts to your environment, you know what's happening. You know that something's wrong, but you can't exactly put your finger on what it is. And it, from the conversations, feels like that's what COVID is. It's like, long COVID is. It's like, I know something is wrong. I don't know exactly what, but how can I find these tools and resources to help me actually put my finger on what's happening? Because I know that I don't feel right. But with that being said, I think that we should take a little break, regather ourselves, and then come back with our part 2. See you guys soon. All right. What's up, family? Welcome back to our episode of Show and Tell, where we are addressing all of our health disparities within the Black and Brown communities. Shaquera, let's start with you after our break. So you have a lot of experience within the medical community as well as the BIPOC communities. And so our question for you would be, what is the importance of collaborations between doctors and community outreach?
First, before I answer that question, I just want to say thank you to Dr. Zai for being here, because this is part of the importance, seeing that representation. Absolutely.
Dr. Zai! Thank you. Thank you.
Seeing that representation, and then also too, having doctors such as Zai and the others who will come on the next episodes, taking time out of their schedules, taking time out of their day to have conversations in this context. Because remember, from a clinical perspective, when you go see your doctor in the office, remember Zai said you have a short amount of time to have these conversations.
Come on.
But these type of conversations are the kind of conversations where we can really engage whole communities, and I think we can reach people from an intergenerational perspective. This is not a conversation that is specific to one certain group or one certain age group or race group. I think we're having conversations that allows people to gain knowledge from a different perspective, hear from an expert, hear from people such as ourselves who are the boots on the ground in the community, but we want to also hear from the community themselves. So we're grateful for the folks who have reached out to us. I think the other thing too to segue into is our partnerships, the people who we link arms with to go into the community, to not just because build trust is becoming like the cliche.
Yeah.
And
Tell me about it.
So the people who we link arms with, who are going to address whatever these gaps and loopholes are, whether it's in public health, whether it's in mental health, whether it's dealing with the social aspects relating to the connection between health and family. And so we're grateful for our partnerships with different communities, because the reality of it is we know from an MACO perspective, we are intentional about who we're partnering with. And so we are making sure that we're partnering with the people who are already embedded in these communities. And so we know the audience, we know the temperature of the audience, we know what they're willing to listen to or what they're going to be opposed to. The reality of it is being culturally competent. And you can't be culturally competent without culture. Ooh. And so the reality of it is I'm glad to be a part of a team where we look like the people we serve.
Come on.
And you have to be willing to serve, meaning go into the community and listen. I love when Zai said that we pause the process. And so pausing the process to build these meaningful relationships so that we can get a better understanding of what is happening to us in our community. Because when we separate public health professionals from the community, that's the problem right there. And I think Zai's representation here pretty much says that we're dismantling that myth that this cannot happen. And so shout out to Show and Tell Boston for putting MACL in this position to be able to do this, be able to have these types of community conversations to this capacity, because we're looking forward to seeing what we can learn from our community, how we can build new partnerships and really leverage that. And then also too, what is the takeaways that we should be able to go back with our team and say, hey, there's some things that we need to fix on our end. So we're grateful for that.
Thank you for sharing that.
Can I just share some of the community examples of community partners,
please,
especially in the beginning of COVID? So We Got Us is a good one. It started in 2020. Yeah, one of the partners of MACL, but also has expanded throughout Boston and Massachusetts. Started by a Black woman medical student from Harvard, and she was like, "What's happened? Why aren't we addressing the Roxbury, the Dorchester, the Mattapan community?"
Who said that, Darian? Who said that?
Lash.
She now goes by
Lash
Dr.
Nolan.
Lash.
Dr. Lash.
Dr. Lash.
We need to invite her on here.
Ma'am.
Yes.
Come on.
Lash.
Come on. Yes.
She's busy. She just started her rounds and
Okay.
MGH, but
Okay.
I'm sure she'll come.
Okay.
But now they do training on medical racism, on on all those different things, specifically giving self-empowerment, self-efficacy to youth, neighborhood youth to do this work. Another example is La Colectiva, which is in Chelsea.
One of our partners.
Again, it started during COVID, and translating all the documents, all the information, because again, not just race, age, but language,
man.
right?
Ooh,
And
that's
so
so true.
they just got a space in Chelsea community, and they did the vaccine clinics, the testing clinics, and then provided food. They cooked because folks were out of work, right? So again, make this a holistic community approach. So the individuals that had their restaurants closed and all the things, they were cooking for community members that couldn't leave the house, right? And they were doing that in that one area, right? And then of course, community health centers. So community health centers started in the 1960s during the civil rights era because hospitals and other medical facilities weren't serving black folks.
Yeah.
So that's why community health centers originated, and as the space says, community, and so they're embedded in these communities and were really, really vital during COVID because other institutions recognize that we have the pulse. We have our finger on the pulse.
Ooh,
and
that's
so
good.
with that, with city and state funding and other funding and initiatives, we did a bunch of things. We extended our hours. We hired more folks, especially community folks that were hired to speak the same languages as the community and work during weekends that the nurses and doctors couldn't do because they were on rotations and being switched out in it from ICUs and ERs and all these things. We've bought multiple health vans that went out to Nubian Square, to Upham Corner Square, to Mattapan Square, to all these different things, to Roxbury Community College, so to provide that education, testing, vaccines, and all those different things. So there are community partners that did the work, are doing the work, will continue to do the work, and it's really just a matter of de-siloing what medicine is and prioritizing the trust building, the relationship building, but also recognizing that yes, the folks have certificates and degrees and all these stuff, but we are our own experts of our own experience, and we should be treated as such when we go into these rooms, right? So we should be listened to in the same degree as the doctors are listened to, because we are with our bodies every single day.
That's right.
And you should be advocating for yourself to do
right.
that. And MACL also provides those different training opportunities and ambassadorships, along with various other organizations, but I think MACL is very particular, especially as it pertains to BMC, because BMC also has the finger on their pulse when it comes to community engagement.
If I can piggyback off of something that Darian said, she talked about health literacy, and then she mentioned the importance of partnerships and meaningful relationships. A lot of the folks you named are our partners, as we said, but there's some other partners that we have in the community who have their pulse on the community as well. One right up the street in this neighborhood is Union Cap in Boston. We are partnered with Union Cap in Boston. We're partnered with the Boston Medical Center's community engagement team. We're partnered with Vital Connections. We're partnered with, I'm naming some folks, Jasmine, the YMCA. Shout out to the YMCA.
Shout out to the YMCA.
That's right. Shout out to the YMCA.
Boys and Girls Club.
Absolutely, because these are places, again, where people like us frequent. And so oftentimes when you are talking about, being isolated in these silos, when everything shut down, these are places that folks couldn't go. And we talk about a holistic approach, and we talk about that healing and that social engagement that it either has a positive or a negative connotation on our health, right? When these places were shut down, these were the groups that were boots on the ground saying, we still have to stay connected to these communities. Shout out to all of these groups who are still to this day making sure when they have a question about COVID and long COVID, they're calling us. Right. And so, the Boston Public Health Commission, they're calling us and saying, hey, we're noticing this is an issue over in Chelsea. This is an issue still in Roxbury, and we're linking arms. That's the importance of all of this that we're doing, is is that we're breaking these silos, if you will, when it comes to the health field, when it comes to, again, the closing the gap between community and public health workers, because the reality of it is like Darian said, we are our own experts, right? And so we can't do this without each other.
That makes sense.
I'm loving this. This is making me a little bit less skeptical as it relates to COVID-19, long COVID, and vaccines. Because again, I'm a conspiracy theorist.
We're about to get her vaccinated.
But I also know the root story of conspiracy theorists too, because I always go back to the root, and it's amazing to be able to give people informed consent and proper and all the information, not simply just half truths, in order to be able to make the decision for their body, for their situation right now. It could possibly change at some point. Maybe you have a baby in a few months, you might want to provide an extra veil and or layer of protection. However, right now this seems to be the best option for me right now, and I need to make sure that I am in cahoots with the medical team or a medical staff or a medical person in order to be able to support me with this decision, rather than make me feel bad or weird or negative for choosing to go with or not to go with the vaccine or other methods of protection.
I want to say something, and then I think we should segue to Zai talking about what should we expect next.
Yes, ma'am.
In terms of what's needed right now, right? We are, and I know some people are going to be like, when I say this, but we are a part of a research team. And so we know the negative connotation that comes with that, but at the same time, we know that we're doing active work that is really working and helping different people in the community. So with that being said, right, we are intentional about making sure we're not going anywhere when the funding ends. The NIH believes in the work that we're doing to the point where we have 4 more years to do this work. Yeah. And while we're not specifically focusing on COVID and long COVID specifically, we understand that there's risk factors from COVID and long COVID that are leading into the other chronic diseases that we're talking about. And so with that, I'm gonna turn it over to Zai so we can talk about what we should expect next.
Please. And Dr. Zai, specifically too, as I was talking about like immunity and COVID and long COVID, I mean, community vaccines and long COVID and immune systems, how can we directly relate the vaccines to supporting our immune health, especially from an infectious disease perspective? Because we're talking a lot about long COVID, we're talking a lot about health, but we're not talking about the infectious disease part of the COVID and long COVID.
I think that's a great question. So the way vaccines work, right? It trains the soldiers in your body, which are the white blood cells, as to how the enemy looks like what is their target, what's going to kill it. And so the vaccines deliver a protein, or in case of Pfizer and Moderna, a messenger RNA. So it's a message on how to make that protein. And your white blood cells are taught that this protein belongs to this virus. It's bad for the body. You need to attack it. And so when you're talking about immune system and how to build it up, that's exactly what the vaccines are also helping you to do. So I think it's a great idea to continue doing vitamins or healthy lifestyle, exercise, the correct diet, like all of that is great, because your immune system is a sum of everything and not just one thing, right? But the vaccines are equally important because they get you ready just in time. They teach you who your enemy is and how to attack it. And that cuts down your risk of having bad outcomes with COVID-19. It doesn't mean that you won't get infected.
That was another misinformation.
Exactly.
Okay.
The vaccines may not stop you from never having COVID, because if people around you have COVID, you will be exposed. You may even get infected. But how long that illness lasts, like, are you successful in winning the war? That's the question, right? And
No. Edge
Education.
But I got a little bit more information, okay? I'm a little bit more informed, okay? I might get it in about a year or two.
Maybe.
But
Thinking about
seriously,
it.
this
This
conversation
is what
helps
is
to
needed.
build the
Exactly.
gap because
I'm closer to it.
yeah, look,
You know,
yeah,
I'm close
might
to it.
one or two
But you see how
degree.
easy, those words came out of her mouth versus
Yeah.
like just saying, "Oh, this is good for you. I know what's best."
Come on,
Yeah.
That's
come
so
on.
much easier.
The language,
Even the kids get that. You get the soldier fighting. I
You
caught
also
that.
get like the compassion too, because it's like sometimes whenever you go into these doctor's office, like you said, like you got 10, 20, 30 minutes to express your grievances, to share how scared you are, to share the medications you've been researching, to you're afraid and you're fully dependent upon this person to give you the tools, the resources and information to try and help what you think to make the best decision for your body. And sometimes when that person is, stressed or anxious, because, you guys are humans too. You have lives prior to clocking in and clocking out. Sometimes the anxiety can be, exhibited or projected onto us and could make us feel like we're not fully listened to,
Stupid
or believed.
like, yeah.
We're being pushed out. You have another patient to go to, so you're trying to just get what you can out of it and go on to the next. But this dialogue helps people, audiences, communities to understand that there are doctors out there who give a freak.
And it's a team approach versus like I know everything, right? That's why we have team members.
Yes.
And how do we make sure, even especially the providers and the nurses, that please listen to them too. We're on the same level, right? Because some folks will be like, "Oh, can I speak to a doctor?"
Right.
Yeah.
And I'm like, "But I get it, but also." And that's his history, right? Because they were taught to only listen to doctors, right?
Yeah.
And so how do we, encourage that kind of
Makes
team-based
sense.
approach?
And before we get to the future of COVID, were there anything that you like to share about maybe that we might have missed about long COVID, or what people can do about that?
Yeah, I think first of all, there's difficulty in recognizing the symptoms for yourself.
Yeah.
So what people can do is, now that you have heard the term long COVID, if you have symptoms that truly haven't gotten better with time, especially while recovering or after recovering from COVID-19, write them down. Like, maintain a diary for yourself.
Yes.
See what makes it better or what makes it worse. Like, are there any triggers? And then take that information to your trusted doctor, your trusted clinician, and get input on it. It's a new disease, so even your doctor is learning along with you. So be patient, right? Like, just because they don't recognize it, or they may say, let's try this, it's not that they're trying to be dismissive. It's more like it's a journey that all of us are on together. Because a lot of times you're used to hearing, oh, you have diabetes, take these medications, we are going to get your blood sugar under control. Long COVID is not like that. I have to tell my patients that you are educating me, and then I'm taking it back, learning more about it, and coming back with a treatment plan that may be tailored to you, because you are unique, because with over 200 symptoms, not everybody is the same. And so, but information is key, information is power. So if you don't know it for yourself, you're never going to bring it up. So at least that's a good place to start. And then if you don't get the answers, or you're not satisfied with the answers you get, look for other resources. Like the MACL team members are out and about in the community. So at these events, ask questions. Don't be afraid of asking. And there's resources that we can provide you access to help you learn and also help take care of you, honestly.
And then what was the future of COVID? What can we expect of COVID?
I know that most people would like to think that COVID is gone, but it's not. I think that COVID is here to stay. It's a unique virus. It changes how it looks like. And that's where all of these variants come from, right? And And with each new variant, think of it like branches of a tree. You started with a little sapling that has now grown up, and it's putting out more and more and more branches, and no two branches look alike.
Oh man.
So to recognize those, you're having new and new vaccines. And so every year, same like the flu, you're going to have a new vaccine, and your doctors. I know, it's an upgrade.
Common language that people will understand.
That cultural competency.
Totally. Yes.
New
And so
iPhone.
be prepared that come fall, your doctor's gonna tell you there's a new vaccine. We need you to get a booster. And then continue, like right now, the number of cases are going up. It's similar to like the surge that we had last year, and also with Delta and so on, and expect the same in winter. So be prepared to mask when you're in crowded settings, especially if you yourself are at risk or you have a loved one who may be at risk of developing severe COVID-19, especially like on public transportations and so on. We are in the middle of summer, so do more outdoor parties as opposed to indoor stuff. And then overall, maintain hand hygiene.
Yes.
So those
Cover your
I
mouth
think,
when you cough and sneeze.
Absolutely.
Or the inside of the
yep.
elbow, please. Thank you.
So I think those are the big takeaways. So COVID is here to stay. So be mindful of that.
And make
Okay.
sure you have a plan, right? So every so often, if you are not in community spaces that actually give away free COVID vaccines, buy one or two. Right, it's gonna help when you start getting that tickle, or after a day or two with the tickle, and then you start feeling weak. Immediately, when you start feeling weak,
Because
take
you know when that
COVID
body's
test.
compromised.
Right, because again,
Yep.
sneezing is flu, right?
Yeah.
And so is maybe headache. But when you start a little bit of something in the sinuses and the nose, or when you start feeling weak,
Yeah.
and the orange juice and ginger ale doesn't help,
That's how you know.
but please take that COVID test. And even I'm very cautious when it comes to things like that. I am always wearing a mask now in
Yeah.
public transportation. I don't know why we didn't do it before.
Yeah.
But having those tests, re-upping on your masks, a lot of places still are giving out things for free, especially if you go to community spaces, especially if those community spaces partner with a health center, a state department, a commission. It's free. Just ask them. They will give it to you. There's literal places that will give you supplies for free.
Nice.
So please ask for it. And then also making sure that you are in contact with some sort of medical professional, because it is hard nowadays. Primary care, which is your head doctor, so primary care physician is hard to come by nowadays. So just make sure you at least have a plan going forward for when those things happen. And there's always, I think there's still also just helplines for things like that too, especially around like COVID things.
Yeah, like the DPH actually has a helpline for treatment as well. And the treatment, you still should be able to receive it at a substantially reduced or free cost. So,
How do you find that the health line? Nice. Okay.
Department of Public Health.
You three as representatives of the MACEAL, what are some things that you would like the audience to know about the organization?
Program or even resources that you guys offer, especially you, Annette, from a program director perspective. Like, what are some resources that are available to the public that they may not even know are available to them? Or maybe even some that you guys have on the horizon in queue to design.
Like next week is August 16th is sexual health.
I'll talk about long COVID. Long
Yes,
COVID.
yes.
Diabetes. We do have resources. For example, if one goes to the MSL website, we do have some resources there, like some educational materials that one can find useful. And what else? We also give out COVID test kits. for free of charge.
Ooh, that's a great resource.
And,
Where do you go to get those?
Yes.
well, if one sends us an email or calls us,
Okay.
yeah, we can easily provide those. But also when we go to events, they are readily available.
Nice.
We do provide those.
Sounds good.
Yeah.
So for the state COVID hotline in Massachusetts, it's SafeLink. That's 877-785-2020. And then this is something that that the state also set up in the very beginning. And folks, I still get these messages. I don't know about you, but it's let me see, Alerts MA. And so they'll actually let you know, especially for folks that still call and say that they have COVID, they'll text you and be like, someone that you were close to got COVID, please get tested or something like that. And they'll give you that updates. And so just Google DPH or Department of Public Health.
Yes.
Alerts MA.
Yes. And to add to what I said earlier as well, we are available as MASCEAL. Like if a community wanted more information about COVID, long COVID, we are available to come to the communities in their spaces to talk about this information.
Okay, so we ain't that special. Y'all coming to any podcast.
I would suggest just take advantage of the community spaces that you are around, right?
That's right.
Community health centers, there's almost one in every neighborhood. Yes. And even if you're not a patient there, you can just go in and ask for the resources that are even right there in the front desk on various topics, addressing different structural drivers of health, like food insecurity or housing or substance use disorder. And so every space that provides a service should have some sort of resource for you. So just make sure that you take advantage of the things that are readily available to you in your space, because again, we are all trying to work together to live a safer, healthier life, and we're in this together.
Whew. All right. Now,
Thank you, ladies, for this information. I know that not only does it help me to feel a little bit more relaxed as it relates to COVID, long COVID, and the vaccine, but it does help our audience to have a little bit better understanding about what we're up against, what it's looking like for the future, and how our community can really be tuned in and utilize the resources that are readily available to us. So thank you all for being here.
Thank you for having us.
You're welcome. How can we find you? Say, we have our audience watching the show and we're like, I totally resonate with what this woman said. I want to reach out to her. How can we find you? And can we start with you?
Yeah, so like I said, I work with health centers, so you can just go into a health center or Google a local health center. Like, for instance, the closest one to Roxbury is Dimmock Health Center.
Community work.
South End Health Center. We have Whittier Street Health Center, Harvard Street Neighborhood Health Center right near Franklin Park. We got Mattapan Health Center. Bunch of other health centers. Just look up your local health center. I guess for me personally, you can email me at let.darian DARIAN at gmail, or look me up on Instagram DLETA14. Yeah.
Thank you. Dr. Zoe, how can we find you? If anybody's like, that lady is amazing, I want.
So that would be a great start, wouldn't it?
Really?
Do you want us to start with you?
no, thank you. Not yet.
But even if we convert one, it's a big success,
Yes,
right?
ma'am.
Tata's gonna come.
I'm gonna do it.
Perfect.
On camera.
Oh, that would be great.
That's what a
Seriously.
lot of doctors did. They
No,
went
seriously.
to Univision and all the faith-based leaders. Don't forget the faith-based leaders. They're doing the work too.
No. So if you want to find me, I work at Boston Medical Center. So you can look me up on bmc.org website. You can also contact the Infectious Disease Clinic. The phone number is 617-414-4290. And even if it goes to the call center, somebody will be able to direct you to the right person, depending on who and what you're looking for. I seem to have forgotten my I don't have a Twitter account, and my Insta. I know you would think I would be living in 2024, but somehow I'm not.
Yeah,
It's okay. We forgive you.
I thought
right?
you'd be tweeting people
But-
get vaccinated.
But I am on LinkedIn, so if
Okay.
you search me by my name, please feel free to contact me. My first name is J for James, AI, and my last name is Mara, T for Texas, HE.
Nice.
Thank you, doctor.
And thank you for having me.
Thank you for being here.
Robinson.
So you can reach myself and Jasmine. We are community engagement specialists with MACEAL at maceal@bmc.org is our email. Reach out to us there and we will follow up with you to answer any questions. We also go into spaces and community spaces where we do tabling. So if someone wants us to come and bring a table, we will come and bring those cool swag that Annette talked about in reference to these COVID test kits when we have them in stock. And so let's be clear there before we get a bunch of calls for COVID test kit. So I just wanted to clarify that. But yeah, you can reach us at maceal@bmc.org.
Sure, just like Shaquera and Jasmine, you can reach me, Annette, the same email as well. And
Oh yeah, we finna wrap up.
okay, before we wrap up,
How can we find you, Miss Annette?
the same, maceal@bmc.org. We forgot to say something at the
us.
beginning. We do have our PIs, who, which is the principal investigator, the director of Maceal, and that is Dr. Ben Linus.
Dr.
We
Ben,
do-
come through. We want to meet you. Come through.
Yes, he's coming, and Gloria Ruiz as well. She's our MPI. We do work with our other teams who are Maceal teams too, who are not here today, but you will still meet them as well.
Okay.
So,
Yeah. Just really quickly, in reference to meeting the rest of our team, Show and Tell Boston will be promoting the rest of our team, doing some video introductions to introduce themselves and what their expertise is. To Tata's point, we will be back here on the couch August 16th with Dr. Gloria Ruiz to talk about some sexual health. Alongside Gloria Ruiz, we will have Dr. Sabrina and Dr. Cassandra. So please be on the lookout. And again, we were intentional in coming in BIPOC communities to bring BIPOC representatives to come and have these expert conversations. So stay tuned.
Yes.
All right, family. This is just one of our 6 episodes that we have in collaboration with our MACEA, our Mass Seal team. All right, we got it. We want to invite you guys to DM us, to reach out to the community leaders, to reach out to Dr. Zai. Please do not be afraid to take responsibility for your health. Okay, because it is better now to take preventative measures than to try to play catch up. It's just not worth it. Okay, we have the tools, we have the resources, we have the help. You guys reach out to us, you guys reach out to these amazing ladies here, and do not be afraid to take full responsibility for your health. We want you guys to come out. We want you guys to be interactive. We want you guys to ask questions, and we want you guys to be proactive about the community, about your health, about the resources that we have available, and about loving on each other and utilizing each resource that we have available to us. So with that being said, thank you, Darian. Thank you, Dr. Zai. Thank you, Shaquera. Thank you, Annette. Thank you to my co-host here.
You know it.
Jasmine, shout out to
Thank you to Jasmine.
Jasmine.
Thank you to myself. All right, family, we're out.
Show and Tell
Peace.
Boston, and that's a wrap.
Thank you.